There's nothing within there anywhere, and you can see the white matter throughout the brain here. We don't see any abnormalities in the white matter. Okay, so now I have another brain MRI over here, and I'm going to use this to compare to the normal one. And you'll see here within the white matter of this brain, there are a few white spots. You can see one there, one there, one there. And these are spots in the white matter where those wires or axons have been damaged, and they show up on the FLAIR sequence in white, and you can see we don't see that on the normal. So these are those non-specific T2 FLAIR hyperintensities that they're talking about. So anything bright on FLAIR, T2 is another sequence you can see here, and they show up bright on that sequence as well. So that's why that term exists, and hyperintense means bright as compared to the rest of the brain tissue. So T2 FLAIR hyperintensities, that's what these are. And the reason why they're called non-specific is because many different things can cause damage to those wires or axons, as I mentioned before. Most radiologists will tell you that we collect about one of these per decade of life. So if you're in your 40s, you're allowed to have basically 4 or 5 of these, and that's considered normal aging. Once you get more than that, many different things can cause these. The most common cause is what is called chronic microvascular ischemic disease or small vessel disease. Basically what that means is the entire brain parenchyma has tiny vessels that go inside of it, and as we age or have head trauma or ingest various different things throughout our life, or even from infections or diseases that we've had, those little vessels can be damaged. Most commonly they're damaged by high cholesterol or high blood pressure, as in other parts of the body. And when those little vessels are damaged, they can cause damage to the myelin, and that will cause these little spots here. Basically, these are little tiny spots of scarring that have occurred because of that. So that's why they're called microvascular disease, because of the small vessels, micro meaning small, and they're called chronic because they happen slowly over time, and you then have them basically the rest of your life. So this person here has several small ones. These are likely clinically insignificant. There are not very many of them, and these are probably due to chronic microvascular disease, as I mentioned. Other things that can cause this, migraine headaches can actually produce these, mostly in the frontal lobes and in what we call the subcortical white matter, which is right underneath the gyri. Demyelinating diseases such as multiple sclerosis can cause these, but in that particular case, they tend to be more round, greater than 3 millimeters, and they tend to be adjacent to this structure here in the midline, which is called the corpus callosum. So I can show you that here. This is the corpus callosum. Lesions in multiple sclerosis tend to be in a longitudinal axis adjacent to this corpus callosum, like this, in a pericallosal distribution. And the chronic microvascular changes tend to be in a distribution like this, subcortical and periventricular, near the ventricles. These are the lateral ventricles. So those are the most common causes of these non-specific white matter changes. There are other causes such as prior infections, inflammatory diseases, or autoimmune diseases. They're basically anything that can cause scarring to the myelin or the axons. But far and away, the most common cause is chronic microvascular disease, which is why it is basically named in every brain MRI report that has these findings. I can also show a more severe example of these findings. So you can see here in this person's brain, this again is a FLAIR sequence, and we can see that this person has basically confluent or patchy areas of this T2 FLAIR white matter hyperintensity, and you can see again It's in the subcortical white matter underneath the gyri, and then mostly periventricular along these lateral ventricles here, which is very typical of chronic microvascular white matter disease, as I previously mentioned. This person would be classified as having moderate or moderate to severe disease, given the confluent nature, and this would be considered atypical or pathologic. So unlike the other case where there were a few dots that would be maybe considered normal for age, this amount of change would never be considered normal. And in this particular case, the patient may actually have symptoms related to this, ranging from confusion or altered mental status or even dementia. Some people may be asymptomatic with this, but this appearance can lead to vascular dementia if it is severe enough, and is most likely caused by hypertension or high cholesterol. There are, again, demyelinating diseases, or what are called dysmyelinating diseases, or leukodystrophies that can also look like this, but they are exceedingly rare, and by far, again, the most common cause of this is chronic microvascular ischemic white matter change or damage due to long-standing high blood pressure or high cholesterol. So I hope this video was helpful in explaining to you what chronic microvascular ischemic white matter disease is, or the nebulous term of nonspecific T2 flare hyperintensities. I know those findings show up on most brain MRIs, and I hope you now have a greater understanding of what that means. If you do happen to have these findings, you can discuss them with your primary care physician or your neurologist and see if they think that they're related to any